Hey everybody, welcome to another episode of Team AC with Aaliyah Crawford. Sitting here with me today is my sister, my blood sister. Her name is Amber Henley, and she is a licensed professional counselor. And we're just going to talk about mental health. I always say that our mental health is just as important as our physical health, and it's something that we must prioritize and we don't always talk about enough. So let's get right into it. Welcome to the platform, Amber.
Thank you. Glad to be here.
So, what inspired you to become a counselor?
So my inspiration started early when I went to Rutgers University and I got a bachelor's degree in psychology, and I was always interested in helping people in some type of way. I was always interested in human behavior. I wasn't sure where my bachelor's in psychology was going to lead me, but I knew I wanted to help people. So then I went to Rider University and I got my master's degree there, and that's where I began my journey to become a licensed professional counselor.
That's awesome. Thank you. And since mental health isn't always discussed, people don't really know what the different roles are in terms of mental health professionals. Can you share what the difference is between a counselor, which is what you are, a therapist, a psychiatrist, a psychologist?
Okay, so a counselor and a therapist are, in many respects, the same thing. A licensed professional counselor gets their license. They have to do a certain amount of clinical hours. In this state of New Jersey, they're called an LPC, but it just depends on the state how they're licensed, which is what makes somebody able to do therapy and be a therapist. But we all know there's different types of therapists. So it just really depends on what type of therapist we're talking about. But a mental health therapist, in most cases, is going to be a LPC. They could also be a licensed clinical social worker. A psychologist is along the same lines, but they're licensed in a different way. They also have more training in doing testing, so they could do psychological testing more so than a therapist or a licensed counselor would have that type of training. And then, of course, a psychiatrist is a doctor, so they go to medical school. The main job of a psychiatrist is to provide diagnosis and medication. So that would be the difference in a psychiatrist. They're not going to really talk to you or do talk therapy and things like that as much as a therapist or a psychologist would, but they're going to be the person that you go to receive medication that can help you get to a better place.
And what's your specialty? What type of patients do you see?
My specialty is anxiety, family therapy. I do marriage counseling, and I see a lot of kids and adolescents. But I like helping clients with anxiety. I've dealt with anxiety myself, and that's something that I really get a lot of satisfaction at, helping people with anxiety disorders get to a better place and feel better and be able to function in a better way.
Awesome. I think in recent years, there have been more conversations about mental health. I think people are starting to understand the importance of it more and what some of the issues are, the different issues that we can experience in terms of our mental health. But what are some of the common misconceptions about mental health and therapy?
There are so many misconceptions about mental health. There's so many things that are just, people just make assumptions about what mental health is. Our brain is a organ, just like every other organ in our body. Our brain can, have things that cause us to not be able to function in the way that we need to function. There are chemicals in our brain that can cause us to not be able to function in the way we need to function. There are things that can happen to us like trauma and other experiences. So I think the misconception is that if you have a mental health, situation, that means you're crazy, or it just means that you need to be stronger. It means that you're just not living life well. I don't know. There's just so many misconceptions. People don't understand that mental health illnesses and mental health conditions run in families. They're hereditary. So there's just still, like in this 2025, right? Still a lot that we still have to fight in terms of misconceptions. people still come into therapy with me and they have misconceptions about what it means to be in therapy, what it means to be on medication. And even with therapy, people have this conception that therapy means you're just going to sit and talk about your problems. Oh, and somebody's just going to sit there and listen to you. And that's not really what therapy is meant for. Therapy is really meant to help you change the way you think, to help you process your emotions, to help you understand what is going on with you, understand what you may be struggling with, to help you get to a better place where you can better function and better deal with the things that are happening with your brain.
Yeah, it's so important. And I think, well, I know that a lot of people don't even understand how mental health symptoms present, various symptoms, and people may not be aware that they can even present as physical symptoms. Anxiety, symptoms of anxiety can be physical, and symptoms of depression can be physical. And like you said earlier, people will say, well, I'm the happiest person I know, or I'm the most positive person I know. I don't have a mental health issue. But you can be a happy person. You can be a very positive person, and you can have mental health issues or concerns. And, depending on, it's just like your physical health. It may not be a chronic thing. For some people, it is a chronic thing. But for some people, it may be temporary or based off of whatever they're going through in their lives at the moment. And there's different stressors and things like that. So it's just important, I think, to maintain your mental health like you do your physical health. Be aware of it. Be very observant when it comes to yourself and your loved ones. Get treatment if necessary. And if you've had mental health issues in the past, to make sure you're just aware, always aware of the different triggers and aware of symptoms and things that could be, that you've experienced before. So
absolutely. And I mean, a lot of times dealing with patients with anxiety, my first clue that it's anxiety is usually physical symptoms. It's not necessarily something going on with their behavior. It's the physical symptoms. They come in saying, I've been feeling nauseous all the time. I'm shaky. My heart is beating fast. Like, those type of things are huge clues that somebody is dealing with a level of anxiety that needs treatment. Or even with depression, like somebody who's constantly sleeping, they can't, they feel just listless and tired, and they feel like they just don't feel well. Sometimes that could mean that they're going through depression. So there's a lot of physical symptoms. Our bodies and minds are connected, like so connected, more connected than people think. So these symptoms can show in both our minds, in the way we're behaving, the way we're functioning, but also in our bodies.
Yeah, absolutely. And I know that personally because I have OCD. I wouldn't say it's obsessive compulsive disorder, but it's behavior, obsessive compulsive behavior that I've had since I was a child. And a lot of those things, obviously, is based off of things that are going on in your mind, but then they present themselves, physically with the things I do, repetitive hand washing and doing things over and just needing to check certain things like the door and the stove repetitively. So it's something, and people may not be aware of that, but that's like a disorder driven by anxiety. And some people deal with insomnia, and that may also be a symptom of anxiety, just like sleeping a lot or being lethargic all the time could be a symptom of depression. So
exactly, insomnia is a great indicator that somebody could be dealing with anxiety. But like you say, it just runs the gamut, and I think when people can understand that more, it's going to help them understand how treatment can help them feel better.
Yeah, and it's really important too, I think, for parents to understand and recognize certain symptoms with their children.
Absolutely.
Because a lot of kids deal with mental health and they don't know what they're experiencing, and a lot of parents may not know what they're experiencing, and they're dealing with things and you're like wondering what's wrong, but it could be like an anxiety issue or a depression issue or something like that. So
absolutely.
Have you noticed any particular, I guess, issues that have become more prevalent in terms of mental health, or things that you think we're dealing with as a society more, or is it just that people are more aware that there's mental health issue, that it is mental health versus something else?
I think think it's both. I think that people have become more aware. They're more willing to get treatment. But I also think we're dealing with a lot more anxiety and depression. I don't know, all of the reasons for that. I don't know, how much societal factors are playing a role in that. I do think we're overloaded with information. And that could be contributing to it. I notice young people are dealing with a lot of social anxiety. I don't know, social media could have something to do with that. But people are also more aware. They're more willing to say, like, something's not right with me, and to reach out and get some type of help. So I think it's a combination of both. But I also think us realizing certain things that, people abusing substances, people dealing with disorders concerning their weight, things like that. We're realizing that those things have a mental health base to them too. So I just think it's a lot more awareness about what's going on around us and how it's impacting people.
Yeah, you mentioned social media, and that was going to be my next question to ask, like, how can the media in general and social media have an effect on our mental health? I read somewhere that they said that the news, the traditional news, a greater percentage of the stories that are featured on the news are negative versus positive. And I know that also does something. People can become addicted to the news. They can even become addicted to the negative stories because it does something hormonally. And it's like, we're taking in all this information. We're seeing stuff. We have access to information more so than ever. We're seeing things that are happening all across the world. We're seeing them in real time. And it's a lot to digest. It's a lot to handle. Who knows if we were even meant to consume this much information at the same time. And, again, we have to process it. And it's a lot for kids because back in the day, kids were shielded to a large degree, but now kids have access to the same information that we do, and it's on their phones or their tablets, and it's on social media. And again, we were a lot of things were kept from us, and before we could handle it, and now we don't know if these kids can handle this information, but they're seeing it.
It's collective trauma, because trauma is another big aspect of our mental health. Trauma can trigger things that we already were predisposed to mental health wise. And I think in many respects we're dealing with collective trauma. We are being exposed to so many traumatic events, so many traumatic circumstances, news that is traumatic, and it can become a collective trauma. And we have to be careful with what we're intaking, especially if we're already predisposed to that. And that's adding on to what somebody's own personal trauma might be, because trauma is another big issue that we have in this society and that we're still learning about. There's still so much research being done on trauma and what trauma can do to us, how trauma actually changes our brain, how people who are exposed to violence over and over again are suffering from chronic PTSD and things that actually change the makeup of the neurotransmitters in our brain, especially when that trauma is experienced at a very young age.
Yeah, and we've all experienced trauma to a greater or lesser degree in our own lifetimes. But then, there's more and more information coming out about epigenetics and the effect that the trauma that your ancestors experienced leaves an imprint on their DNA that is passed down to you. So things that your family may have experienced generations ago is literally embedded into your DNA. And this, to some people this may be controversial, but it shouldn't be, because we're just dealing with facts. There are things that we've experienced and people in the U.S. have experienced that people, there's a bigger drug problem here than in other places. There's a bigger epidemic in terms of violence and gun violence, racial violence. We have to deal with the legacy of chattel slavery and Jim Crow and all these things, institutionalized racism. And, we're living with that. We're walking around with that, being involved in numerous wars.
Absolutely.
And, and like I just mentioned, drugs. And that's a generational thing too, because a lot of times those addictions may be passed down or whatever, or the lifestyles that contribute to the addictions, or the mental health issues that might contribute to the addictions. And then, again, it's generational, because you have the person that may have the substance issue, and then their children, everybody is affected in the family.
I would encourage everyone to read some things on generational trauma, because generational trauma is a real thing. And trauma is passed down from generation to generation. It's passed down in behavior, it's passed down in genetics, it's passed down in so many ways, and it's affecting us, especially in the African American community. I read an article one time, it was so interesting to me. It was talking about survivors of the Holocaust and how they tested, even to this day, they tested the cortisol levels in people who were descendants of people who had been victims of the Holocaust, and that they found that even to this day, people in that population of Jews had less cortisol in their blood, because their ancestors who were victims of the Holocaust had to reduce their cortisol levels to such a low level to be able to survive that level of trauma, that it is still being passed down. So I mean, it's amazing, like when you research some of the things about trauma and how it's passed down. But it's definitely something we're dealing with, and I would encourage people to really read about it and understand, and look at your family. And I encourage my clients, ask questions, talk to your family members, figure out, where some of these things came from, these patterns of behavior, and how you can start to address it, because it has been passed down, and how you can stop the chain.
Yeah, stop
the chain
the cycle.
Of events, the cycle,
Yeah.
right? That's the word I was looking for, the cycle.
Yeah, and some people may not even be aware that there are clinical disorders in their family, and because it's not talked about, things like bipolar or schizophrenia.
Absolutely.
And I think that's important, because, again, people need to know if these issues may run in their family, or if they're experiencing certain things, and it could be a link and you're not aware that there's a link.
Absolutely. And it's information that should be given in families, so people understand what they're dealing with and what possibilities are there, and if they experience something, so they can understand and get treatment early. That's the main reason why it's important for us to talk about these things. So if someone is experiencing something, they understand, one, it's not your fault. Two, this could just be something genetic that's in your family. And three, that there's ways to treatment. There's actually,
and it's a chemical thing, it's a physical thing.
There's actually even now, I don't know if everyone, how many people know this, but there's actually now in psychiatry and doctors, psychiatrists that can do genetic testing to actually see what medication will work best for you. So this is like now really giving us proof and understanding that these things are chemical, they're genetic. So there are specific types of psychiatrists you can go to and actually get your blood drawn, get genetic testing to indicate what medication will work best for you. And another interesting aspect of that, if you researched it and looked into your family and these things are passed down, what normally works for one family member in terms of medication, you will find will work for the other family members, because it's genetic.
Yeah. Yeah, and it's like these things, you want to make sure that you become aware if there's an issue, and then you get help, because it just like with your physical health, mental health it can become progressive.
Absolutely.
And if it's left untreated,
the worse it gets.
The worse it gets, and the harder it may be to treat, versus if you catch something early.
Absolutely.
So, what advice would you give to someone who is considering therapy or counseling but is hesitant?
I would say to just try it. to find a therapist that's going to be a good fit for you, to not give up if you go to a therapist and you feel like that's not the right therapist for you. You know, to ask questions and do a little research before you find a therapist. But to just give it a try. Like, you don't know, you know, if it's going to work for you if you don't try it. If you try it, and I would say if you do try it and you feel like it doesn't work at first, maybe consider trying another therapist. Don't just give up on it because it didn't work the first time. But really, you know, give it a chance. So many people, you know, come in and it's their first time, but they leave so thankful that they gave it a chance because they are able to work through some things and build an understanding of themselves, what's going on with them, symptoms that they're having, how to deal with those symptoms, and how to really like improve their lives.
And like you said, if you try one therapist and you don't think it's a good fit, don't let that discourage you. Find another therapist. It's just like with anything else. Sometimes you go to a doctor and you may not feel the doctor has the best bedside manner, and you're like, I have to go to another doctor. Or, you know, a hairstylist or a barber. Because we won't just scrap that and say, hey, I didn't like the way this person did my hair, so I'm never going to go to the beauty salon again. It's like, no, this is my mental health. It's important. This therapist may not have been good for me or my situation, but I'm not going to give up. I can, you know, go and find a person that's going to be able to help me.
Yeah.
And that's most important. And I just can't overemphasize how we have to prioritize our mental health just like our physical health. And also we have to prioritize, we didn't really get into this, but also our emotional health.
Absolutely, because that's all part of it.
Yeah.
Right? Our emotional health is all part of our mental health. And, you know, ensuring that we're emotionally healthy.
Yeah.
Because that being emotionally healthy really impacts your life in a huge way. If you're not emotionally healthy, it's going to be hard to make good decisions for yourself. It's going to be hard to have the right people in your life. It's going to be hard to communicate in the way you need to communicate. So our emotional health, which is something else that you can work on in therapy, and a lot of people don't realize they haven't been taught.
And that it's different, that your emotional health it falls underneath your overall mental health, but it's different because you could be having issues emotionally or going through things in life that affect your emotions or have even emotional disorders or problems, but that may not be a mental health issue. You may not, is that correct?
Yes, and that's another misconception about therapy and mental health. Sometimes you may need to come to therapy because you're having an issue with your emotional health. You could be going through something. You could be going through a divorce. You could be going through grief, which is impacting your emotional health. And that's why you're coming to therapy. Everybody who's coming to therapy is not coming because they have a diagnosable mental health issue. Sometimes we just need a little help with our emotional health. We need to talk to somebody and get these feelings and these thoughts and these emotions out, clarify how we're feeling, what we're feeling, what we need, how to communicate what we need, like the whole gamut. But I'm glad you brought that up, because that's another misconception, is that therapy is just all about if you have some type of diagnosable mental health condition, and it's not.
And it's not. And like you said, you could be going through a breakup, you could be going through, career changes, you could be going through grief, and you may need that support to get you through that phase in your life, and to help you deal with it, and just to give you tools. Sometimes people can give you tools or perspectives or insights on how to handle certain things that you didn't have or that you weren't even aware of.
To give you tools and to have someone to talk to who's not emotionally connected to what you're going through. Because it's very different if you're talking to someone who's emotionally connected to what you're going through versus someone who can look at it objectively because their emotions are not involved in it. Which is the point of being a professional, because you understand how to listen and give feedback without emotionally connecting to what's going on with the person, to where you're going to create biases or give them information just based off of emotion, which a family member is going to do because they love you. So that's why they're going to give you information based off their emotions, a lot of times not based off the objectivity of what is going on.
Right, right. So how can we support a loved one who might be struggling with their mental health or emotional health? How what do you recommend to people if they see
Being
that?
willing to talk about it. Being willing to support them and say, have you thought about going to therapy? I would go with you if you need me to. If you've gone to therapy, talking about that and saying, I've gone to therapy and it's helped me. If you've dealt with mental health and you've had to take medication, being able to be honest about that. Just being willing to talk about it. The more we talk about it, the more we normalize it, the more we're going to be able to support people and help them get that assistance that they need.
So obviously, you being a counselor doesn't absolve you of having experienced your own difficulties, both professionally and personally. You want to talk about some of the challenges you may have faced as a counselor? I guess just dealing with, that being your profession and how you've coped with them? Or does it put, I guess, extra... I guess you have a certain heaviness that you can walk away with after dealing with your clients. Is that accurate?
My heaviness is more just if I feel like I can't help someone. I don't like that feeling. So just being able to deal with that I can't help everyone, that you have to be able to, I'm trying to think of the right word. You have to be able to let go of things, and you have to be able to release, the stress that you feel
And accept.
Accept, what's going on in your own life, and that you're going to have limitations when it comes to being able to help people, but to be able to accept that you're always going to, do your best to do that. It can be challenging.
And it's a process. Because when you're in your type of business,
a serious process.
It's not going to be an overnight transition.
And that's another misconception about therapy, right?
Right. Sometimes people think they could go to one session and it's like, snap your fingers, I'm better. But again, it's treatment, just like when you're being treated for a medical condition. And even after you're treated and you may have surgery, then you have to have physical therapy and there's a recovery period. So I think people have to realize, and a lot of times, from what I've observed, by the time some people get help for a mental situation, it's reached an acute point. Just like with their health, sometimes people don't go to the doctor, like they're literally, they're having a heart attack,
Absolutely.
And so once it gets to that level, that high level, it's going to take time.
Absolutely. And think about the fact that
to heal.
If you're 40 years old, if you're 37, 45, whatever, you've been in these patterns and these thinking processes or dealing with certain issues for years. So something that's built up for years, or a pattern you've been in, or a pattern your family's been in for years, you can't change that overnight. That takes time.
It does.
Right? It takes time. It takes work, and therapy is work, because you can't just go there and sit and say this is my problem, but not work on it as you go along.
For sure. Outside of seeking therapy, if you need it, what are some self-care practices that you use or recommend to people to just manage, I guess, stress, manage, everyday concerns that people have?
I would say journaling, and I know everybody doesn't like to write, but with technology, we got the journal app on the Apple, on the iPhone. You can speak your journals if you need to, but just jotting down things that are in your brain to kind of get them out of your brain and understand what your issues are, what's bothering you. Reading, finding books that may help you with whatever issue you're dealing with, or at least help you understand it better. Physical exercise, getting outside, sunlight, doing things that you enjoy. All of those things are important, and expressing yourself and learning. If you struggle to express yourself, putting that time and effort into learning how to do that.
So, if you could share one message about mental health, what would it be?
That it's important. Your mental health matters. It's important that you take care of yourself physically, that you take care of yourself emotionally, that you take care of yourself mentally, because it can impact your life in so many ways. In so many ways, if you're not taking care of it, if you notice that you are feeling something that is really preventing you from being your best, it's really impacting your life, to get help. And that it's okay. It's okay to talk about it. It's okay to get help. It's okay to reach out to someone, and that the treatment that's out there, it can help.
Yeah.
It really can change your life to be able to address what's going on with your mental health.
And you may be doing other things that are negative or problematic, you know. Sometimes people are self-medicating and they don't realize that there's a mental health issue that they're trying to, and they're using substances or food to cope with. And I think that's an important thing too. Sometimes you may wonder why you're struggling with certain things, and you have to look a little bit deeper and see, like, could this be a mental health issue that I am just trying to suppress or cope with?
And ask yourself what negative coping skills you are using, and ask yourself, how long have you felt this way? Because I have clients come in, and in therapy they realize they've felt this way since they were 11 years old, 10 years old, 12 years old, which is more of an indication that, you know, this is something, you know, chemical going on in their brains, or some long standing trauma, or whatever the case may be. But if you've been feeling this way your entire life, you do not have to suffer. I think that's what I would go back to too, because one of the reasons I do this, and what I hate to see, is people suffering when they don't have to.
Yeah.
You don't have to suffer.
Do you want to share your social media handle?
Oh yes, my social media handle
People,
is
if they want
Counselor.
to reach out or follow you or get in
Yes.
touch for any reason.
It's Counselor A. Hen, and I also have a website, AmberHenleyCounselingServices.com. So if you want to follow me, if you want to reach out and message me with any questions, feel free to do that.
We'll leave that contact info in the description as well. And you can follow me on IG at Aaliyah Crawford _. That's ALIYACRAWFORD _. Thank you everyone for tuning in for another episode of Team AC. Thank you so much, Amber. I really appreciate you joining me.
Thank you.
Very important conversation. Until next time.